And with that, we'll go into our main item. Kathy and Jenny giving us our weekly update. Good morning, you two.
Good morning, Mr. Chair and Commissioners.
Morning.
Better be all good news today.
It's all good news. Merry Christmas.
Okay.
Yeah, you can see our numbers are leveling off. Maybe if I take this, I can hear some feedback. The numbers are leveling off a little bit. We still have 6,003 positive cases in Clay County, 73 deaths. So we have a few more deaths, which is, of course, unfortunate. And the 14-day case rate, which only goes through 12/5, is 136.3. And as I had some of my data people kind of project for the next period, 2-week period, and it's going down. So that'll even be less than 100 projected.
Kathy, can I just interrupt you for 1 second? Just for the public, because you just, at the very start, you said we still have 6,003 positive cases. I don't want that to be confused with active cases.
Yeah, no, that's not active cases, correct.
Okay.
Thank you,
Thank you.
Commissioner Campbell. That is our total positive cases. Yes, just not to be confused with the active cases. That is correct. And then we have total positive cases for Minnesota, almost to the 400,000. And cumulative deaths are 4,872. So always sad that, you know, we have deaths from this virus. And then, yes, so Commissioner Campbell is right. We look at the next page, and I shortened the graph just because there's, we're often not looking back to March. So that's why you're just seeing the November, excuse me, November through December 16th. So we're looking at the number of cases. And there's a different number. As you can see, that's December 16th on this page. This one was updated as of December 18th, so it's a little bit of variance in those total cases. And then we have how many are coming out of isolation. So that's the number of people that have recovered from COVID and now are out of isolation. So our active cases at this point, and again, as you can see, it varies, it's at 370. So we know that the jump in positive cases are much less. It used to be around 600 each period that we've been reporting, and now we're down between the dates closer to 200 to 300. So the positive cases or the active cases are down. The positive cases, there's still an increase, but they're less. So as you see the graph, it's looking like it's tapering off a bit, or what we call leveling off. So that's the good thing. I mean, when we talk about our public health prevention measures, we talk about the masking, you know, trying to avoid those large gatherings. I think we're seeing the effects of that. Some of those measures that seem to be an ongoing thing that we talk about constantly are still allowing us to see a reduction in those positive cases. So that's the good news. And then the level of exposures is pretty much the same. We're still seeing it's in the community for exposure. And then you look at the graph with the ages, and you can see the cumulative ages, and the highest peak is at age of 20 to 24. And then there's some of the other ones that are also high, the 15 to 19, and the 25 to 29 age group, and then the 30 to 34. So those are our top age groups. And then you see, as Commissioner Campbell had asked about the ages of the active cases. And so you see there that it's still the 20 to 24 is the highest. And then we're seeing now the 40 to 44 are some of the active cases where we're seeing a little bit of a peak. And then the typical other ones are still 15 to 19 is down a little bit, but the 25 to 29 and the 35 to 39 are up there. So, you know, it's interesting how that graph is. It's still the main 20 to 24, but you see the 40 to 44 in this active case group. So a little bit of a change there. North Dakota is also reporting their numbers are down a little bit. They're still at a cumulative, North Dakota as a whole, a cumulative positivity rate of 23.72. So that's still up there a bit. None of us are out of the woods. It's nice to see that, you know, we were expecting a big surge right after Thanksgiving, and people followed the guidance, I think, very closely. So that's great for the community to continue to do the masking, the social distancing, all of the measures that we talk about. We do have two major holidays, of course, coming up. Christmas is the one that's concerning, because we do know that's a holiday where people want to gather, and we understand that. So we'll see what happens after the holidays. The measures are still the same, where we're really telling people to be careful about those gatherings. And then, of course, we have New Year's as well. So a couple of holidays that still may impact what we're seeing, but it's looking better, so we're optimistic about that we're slowing and spreading out that tidal wave of cases, basically. So they also talk about, and you maybe heard on the news a little bit, about potentially maybe a new strain of this COVID virus. We don't know if it's here. There's some prediction that it's here already, but nothing is confirmed about that. It's not the prevalent one. It's not the dominant one. But we know even with influenza, that's why they create the vaccine every year, because they're looking at the worst strains, which is the strains that are really going to cause death and severe illness, and that's what they're looking at. So, you know, that varies. So we'll see. This is coming at a time where we're also, and Jamie's going to talk about it in just a minute or two, about our vaccine and our vaccine distribution. So it's coming around that same time.
Kathy, if that were here, would that strain be picked up with those tests?
I'm not sure if we've heard how they're going to pick up. Jamie might know.
You know, I believe I was listening or reviewing the notes from the governor's or Commissioner of Health discussion yesterday. And my understanding is that that was a lab question, but they understood that it would be picked up by the lab.
Okay.
The different strains are currently being studied by the Minnesota Department of Health lab.
Okay, thanks.
We also had a meeting last week with Sanford and Essentia and other providers. And Sanford and Essentia are feeling pretty good about their numbers. Their numbers are going down as far as the surge of cases that they're dealing with. So they're feeling they're at a spot where we're not seeing that across the country. There's hospitals that are really in dire straits. But at Sanford and Essentia, the numbers are manageable. They're talking about the numbers are not, they're not overwhelmed with the cases of COVID cases. So that's good. And their staffing is better. You know, they had a lot of recruitment of getting staff in to deal with those surges of cases. But at least at this point, as of last week, they're feeling good about the numbers. So that's good for our region, that the numbers are a bit better in those hospital situations. The testing continues. We have the saliva testing site. And we don't know exactly, you know, that was supposed to end in December, the end of December, they call them the semi-permanent sites across the state. But we've heard that's going to expand, but we don't know how long they'll be here. But, you know, they're still doing a fair amount of testing. And as of last week, December 13th, they did about 3,591. So it's still a great site to provide the testing that we need. And the turnaround time is good. We're hearing people getting results in a fairly expedient way, sometimes within 24 hours or a little bit more. So we're grateful if they continue, because that's a good resource for us on this side of the river. And we also serve North Dakota folks as well. So it's a really good resource to have that. So we're glad they're going to continue. We just don't know what the time frame will be.
Excuse me.
Go ahead.
Is that the only site that's open? I mean, there's nothing open in Fargo, West Fargo area? I mean, that's just open for people that can walk in. The North Fargo has a site in West Fargo, and they are open Monday through Friday, and they do swabbing for anyone, and it can be for Minnesota folks as well. So that site is still open Monday through Friday. You can register online, and that's pretty slick as well. So there's two sites available for people, okay.
Correct.
Yep.
Sorry, Gabby.
Along with the medical, Sanford and Essentia have their ability to test too.
And the home testing is available also through the Minnesota Department of Health. You can actually request a kit. It'll be sent to your home.
So the 35, now the 3,500 number, that's in a week's time, right? That's.
Correct, yes, for the
That
testing.
seems like that's down about 1,000 compared to where it had been.
Yes, it has varied. It was, it ramped up. The highest amount of testing we did was the week of November 15th. We did 5,800 tests. And then the following week, it went down to 4,500.
Yeah.
So we went down 1,000. And then the week after that, it was 42. Now we're at 31 and then 3,591 for this week of December 13th. So whether that reflects, there's maybe less people getting tested. There's, we know that there may be students out of the area now and in various things, but it's still a good place to get tested. We've heard people say it's so much easier than the swab test.
And that can be a lot of retesting too, I suppose, too, right?
Right. And I know that the higher ed, when we talked with them, they're hoping to have the ability to test students as they come back. So we're working with this Vault company to make sure that they have the capability and capacity, and sounds like they do.
Can I, you talked about this, that they opened a place in Fargo for the special plasma treatment stuff with. Have you heard-
Yeah, do you
is it-
remember,
Have we
Jamie?
heard any more on that? Is that,
I guess I personally haven't heard a lot. I've heard of one person that went and had the treatment, and that was actually in Castleton, and it was very effective. The person did very well. It was a woman between the ages of 65 and 70, and she had chronic health conditions, and she did very well. But it's available. I don't know why we're not hearing very much
well,
about it.
yeah, and again, that's, that process would be prescribed by a physician to do that, right?
And the goal is to have that treatment prior to hospital level of care.
Right.
Where if you're in the hospital, they have the plasma donations that
Right.
they would like to be using.
I was just curious, because I haven't heard any more on how often that was used.
Yeah, we can see if, on our Wednesday call, if they have any more information, we can ask that question with the other healthcare providers.
Thank you for bringing it up, though, because I think it needs a little attention. I think
Yeah,
it's
well,
a
yeah.
Absolutely.
utilized resource.
Well, and I think if somebody goes into it, sometimes it might be a good thing on the part of the patient to ask their attending physician about it too,
Yes.
that might help a little bit in being able to have that treatment provided. So.
Absolutely. Yeah. Okay, I'll let Jamie talk a little bit about our vaccine distribution.
I talked about vaccine last week, but we are getting a lot of questions about vaccine and when it's coming and for what target population, so I'm just going to talk a little again about that. But basically, first of all, the goal is for everyone to have the COVID vaccine and for it to be readily available to all people. So when we think about that, we think about where we go for our flu shots. We go to our primary care provider, we go to the clinics will do like blitzes, so you can come in, you don't even have to have a provider at Sanford Essentia Family Health Care in order to have that flu shot, and you can go to your pharmacies and walk in. So that's the goal, that's where we're seeing that we will get eventually, but because we have a limited supply, we are having to prioritize. And when I say we, that's at the CDC level, and CDC is taking their advice from medical experts in terms of the high-risk population. So right now, the target population is healthcare providers and long-term care residents, and that's based on science. So they've studied basically those in long-term care. Not only are they in long-term care because of their age and often because of chronic health conditions, not always, but in most cases it's an age and chronic health condition, but also because of the congregate living setting. And so that puts them more at risk. We've had questions from people that are living in senior high-rise apartments, and although that is a top priority, we are focusing on those that are in a congregate living setting. And then our first priority in Minnesota is with the healthcare providers that are treating those that have COVID. So that's the first wave. There are a lot of questions, and I'm sure you're getting those questions. We get them every day from the public and from friends and family. Should we get the vaccine? And I think that's the one thing that I wanted to just really stress is the vaccine is safe. It has been tested. Many trials have been done. The questions that are coming up right now have to do with things that have not been tested. So they haven't tested children yet. They haven't tested pregnant women. They haven't tested people that are breastfeeding. But the experts are evaluating what is the probability that you would be safer, and then also looking at the risk for a pregnant woman. And so each of those individuals are encouraged to talk to their primary care provider and ask questions, but also look at the research. So the organizations that represent pregnant women and professional organizations for breastfeeding are the ones that are weighing in on what the risks are. So it's a risk-benefit. The benefit definitely outweighs the risk when it comes to COVID vaccine. And so that is, number one, is that we are saying, yes, the vaccine's been studied, the trials have been very thorough, and we encourage you to get that vaccine. Just a few of the things that are, when we have a short supply, they're looking at in the healthcare providers, anyone who's had the vaccine and is in close contact with people with COVID is encouraged to have the vaccine. However, if they have a low number, then they're looking at deferring for someone who's had COVID in the last 90 days. So it doesn't mean it's not important, it is, but if there's a shortage, that you pass that dose to the person that has not had COVID. So those are the things, looking at chronic health conditions in those healthcare providers. So when we talk about those two priorities, healthcare providers, that covers a lot of the people in our community that also have chronic health conditions. So we're kind of getting both of those two things covered when we're addressing healthcare providers. The questions that keep coming up are like, what's the next population? And that really is being studied on a regular basis. For us in Clay County, our charge with the vaccine that comes to us is going to be for those that are first responders, like they are the ones that arrive when someone calls an ambulance kind of thing. And then also for those that are doing vaccinations and those that are testing. So again, it's that close contact with a person that's potentially infectious. Very limited amounts of vaccine is coming to us, but it will continue to come on a weekly basis. So the planning that we are involved in right now with our state health department and our regional hospital and healthcare systems is looking at, first of all, getting our healthcare providers covered. Second of all, getting our long-term care providers and residents covered through the federal pharmacy program. And then for us in public health to be focusing on those that are not associated with a healthcare system and our emergency, our EMS staff that are not associated with the healthcare system. So the vaccine will continue to come weekly. It's when we get our vaccine, at the same time that we're waiting for shipment, we're also working with the state health department on the protocols to follow for the vaccine, and there will be required training for staff that are going to administer vaccine as well. The next thing once we get those protocols is to get our doctor's orders, because that is, we do require a doctor's order for administration of that. In the meantime, we have a plan that we're working on with the state health department and how to address the populations and where to best serve them. Another priority for vaccine is that it's not sitting. So we have to look at if we have a population that's available for the vaccine, and we don't have the numbers, then we need to look at the next level, and that is all guided through Minnesota Department of Health.
So just to add on to that, and that was a good review. Initially, our plan will be, and we're going to get the vaccine potentially the end of this week, so we could start vaccinating next week if we have the protocols and the doctor's orders. Otherwise, it'll be the week after. We need to do the saliva testing, folks. That's our responsibility, public health. So there's 40-ish employees there, so we need to get those people vaccinated because they are doing at the testing site. We will also be doing our nurses in our own department that will be providing vaccination. So we need to get those people. So those are initially our 2, and then, we're going to get maybe 100 doses this first round. So we may be able to start on some of the EMS folks at that time. So that'll be it's a small amount of doses. It's not going to go a long way, but we'll be getting, as Jamie described, every week we'll be getting vaccine. We don't know the quantity. They have not told us. They told us we should get about 100 this week, but we don't know the quantity after that. And we're getting the Moderna. We're not getting the Pfizer vaccine. So the storage and handling is much easier on the Moderna vaccine, which is frozen or refrigerated. If we put it in the refrigerator, it lasts 30 days. So we need to get the vaccine out as quickly as we can.
So just a couple more things that people have been asking about is, will it be required? No, it is not. It's optional for people. No one will be required, just like a flu shot. It's not required at this point. Will there be a cost? There will not be a cost to individuals. There is the vaccines being provided to us, so there will not be a cost for that. And then how many doses, basically, just to repeat that, 2 doses. For the Pfizer, it's 21 days later. There's a window there. It could be a little bit early, and it can be later, and you don't have to repeat the dose. The first dose if it's later, and then the second with Moderna that we'll have is 28 days. And so, again, that's the goal, but it can be a little bit later and a few days earlier.
And just for the public, and this has been on the news too, this is going to be a number of months of vaccinating. So we're getting the high-risk priority groups that the state has set up, and so they're in phases. So we're following those phases. Just for the general population, it's going to be a number of months down the road, because we get calls, when can we get the vaccine? Just someone in the public. This is going on for quite a few months. Into spring is at the anticipated time. So we'll be continuing to vaccinate every week, hit all of the priority people, and then move into the next phases of others.
Yeah, thank you. That's kind of goes to a couple of my questions here. So the protocol that you have for who gets it in line, that you're talking about the doses of the vaccine that come through public health.
Correct.
Correct? Because I read this morning too that CVS Pharmacy is expecting to vaccinate 63,000 people in Minnesota. It didn't give a timeline for it, but I'm assuming that that CVS Pharmacy, Walgreens, and some of those will also be getting some sort of proportionate amount of vaccines. So how does that work then in terms of prioritizing? Is it just goes to their customers in general then, or?
Well, their requirement in Minnesota right now with their contract is doing the long-term care. So the pharmacy, the CVS and Walgreens, they're going in and doing all the long-term care individuals across the state of Minnesota.
Okay, but those doses are not counted in the numbers that we get that go to the public health. So
Right.
those are additional doses that are available that can, give some encouragement that there might be a little bit more going on than what you can talk about.
Right. Exactly right, Commissioner Campbell. And the healthcare facilities are taking care of their own healthcare individuals. So in other words, Sanford and Essentia will take care of, if they have clinics, they'll take care of their clinic staff. So public health will be responsible, as Jamie described, for all the other ones that aren't affiliated with a healthcare system, that are a lot of the rural EMS and, law enforcement. Those folks will be managing those with our doses. So that's right. You're right. There's other doses coming in.
And that's the Federal Pharmacy Partnership Program, the PPP that we've talked about, which is huge, and that will definitely be coming into our community very soon.
Good. Thank you, Mr. Chairman.
Other questions we can answer?
Must have given a good report if there's no.
No questions, or it's too early in the morning. Thank you very much.
Thank you for the update again.
Thank you.
Thank you for your work in that.
Thank you.